Hello and welcome to another episode of Microbially Speaking. I'm your host, Dr. Kevin Stinson, microbiologist and infection control professional. If you're a new viewer on the channel and this is your first time joining us, then welcome, glad to have you. Be sure to hit the subscribe button below. If you're a returning viewer, then welcome back. Glad to see you again. We are, of course, talking today about yesterday's bombshell announcement and executive order signed by President Donald Trump with regards to vaccines, his delivering gold standard childhood vaccine recommendations for Americans. We're going to spend a little bit of time today taking a look at that actual press conference that went along with this. We're going to take a look at the content of the executive order itself. And we're going to talk a little bit about some of the science, some of the nuance, and unpack a little bit of the political rhetoric that was said throughout all of this and whether or not there's actual validity behind it. Stay tuned. All right, so Donald Trump made some pretty big and bold claims on his press release for this executive order. Now, it's important to contextualize here a little bit about some of the background on this. So the CDC back in January actually made some recommendations, some adjustments, and changed the recommended vaccine schedule for the United States. And that schedule is much what we see in this executive order that was released yesterday. The big barrier, of course, is that initial decision back in January was challenged by in federal courts because it was determined that RFK Jr. did not follow appropriate legal proceeding to enact such changes in policy. And that might not seem like it matters much to people who are really, really strong proponents and advocates of this work. But we got to think through and realize that when any time we start to erode the foundational steps behind decision-making and politics and trying to develop policy safely, it creates a really slippery slope for what's the point of checks and balances if we're just going to violate them. But anyway, beyond those foundational points that were made back in January that are being recycled here with this executive order, my apologies, we also see some new materials and some new language being thrown into this with regards to dosing of vaccines, sequencing of vaccines, as well as promises for research into future scientific safety measures. So let's take a look a little bit right now, take a look at some of the key points and key statements through the press release and unpack these together.
For long and far too long, a long period of time, America's recommended more childhood vaccines than any peer nation, and even twice as many doses as some European countries, and even more than that.
So right off the bat, making claims of other nations had far lower vaccine recommendations than the United States. Now, I'm not an American. I live in Canada. And when we look at current day Canadian standards, when we look at the vaccine schedules for other G7 countries, all of the countries are fairly aligned here. And now the United States went from a point of being very well aligned to G7 nations to now one of the lowest recommendations. And he talks about Hep B being one of the things that's been removed. Hep B, of course, has a significant risk of chronic lifelong infection, chronic liver disease. And when we look at the CDC's own data, the impact of childhood and infant vaccination in reducing the overall impacts of hepatitis B across the United States has been significant over the past couple of decades. Other countries do have Hep B as part of their routine childhood vaccination programs. So these claims that this is bringing the United States more in line with other nations, just right off the bat, seems like a fallacy.
Effective immediately, my administration is recognizing gold standard childhood vaccine recommendations for only 11 core vaccinations against the most serious and dangerous diseases, along with the MMR, which hopefully will be split up You have the MMR. We want it in 3 separate vaccinations, given at separate times. Together, there could be a possibility they're quite lethal, and separately, it looks like they are not at all lethal, but just very effective.
Okay, this is a ludicrous claim right early off into this press conference. Making such dangerous claims of together the MMR could be quite lethal is insane. Even in last week's absolute disastrous interview between RFK Jr. by Dana Bash, RFK Jr. made the statement that he recommends the MMR vaccine. It took a little bit of kind of coaxing to get him to actually say those words. And he acknowledges that the MMR vaccine is probably the most studied vaccine in childhood. And the efficacy and safety of that vaccine has been exceptionally well documented. There is significant research into MMR in particular, because of course the MMR vaccine and the work of the Wakefield study that kicked off this whole vaccines and autism endeavor, which of course was fake research by a now discredited physician, is not something that is worth actually taking in any way, shape, or form as valid scientific analysis. That kicked off this whole campaign against MMR. And countless study after study after study after study have showcased the safety of this three disease vaccine. So trying to make a claim that there's quite a risk of lethality behind this vaccine, but it's fine if you give all 3 of them individually, is just completely unfounded and completely a irrational statement. This was one of the big claims in this new executive order, or rather the big changes in this executive order that wasn't talked about last January, and there's just simply no scientific rationale behind that statement.
The vaccine being broken into 3 separate single doses and vaccines being administered in separate visits. For example, at 1 year, you should have 5 separate visits for vaccines rather than getting them all in the same day. And I saw this early on, and I've seen proof of it, where they have a vaccination that looks like the size of a bottle of soda poured into a little child's body. And bad things happen in many cases, in too many cases, because this is an explosion. This is an epidemic.
Yet again, just extremely strong rhetoric with little foundation in science coming out of this press conference. So let's unpack some of this here. So a statement of by 1 year, there should be 5 separate visits for vaccinating your child. And so each one you're getting 1 vaccine. But what that doesn't take into account is that some of these vaccines that have multiple different targets within 1 dose need multiple doses throughout that first year of life. And so the biggest one is, of course, a 5-target vaccine. So you have tetanus, diphtheria, pertussis, polio, and then Haemophilus influenza type B. It's a nice 5-in-1 vaccine that is dosed multiple times in the first year of life. And so that appears to be what he's talking about with this notion of 5 separate visits as opposed to all of that in one. But you already need multiple visits for that vaccine. So are you actually doing like 15 separate visits in that first 10 to 15 months or 12 to 15 months of life? It's not really well explained and clear here. And that would imply that that 5-in-1 vaccine is also being split, which wasn't something that was called out in the executive order. So it's a little unclear here where he's going with this. But he makes this bold claim. He makes this claim of you have vaccines the size of Coke bottles being injected into tiny babies. And so I want to show you here, this is our Coke bottle. That right there, you see, that is 0.5 milliliter. That is our 5-in-1 vaccine dose. This is our Coke bottle or our soda bottle that we're injecting. This is not a huge amount of volume. Now, of course, this you can see is colored yellow. This is not actually a vaccine. That was iced tea. But the point is, he's making these bold claims about huge volumes, giant needles, and that's not the reality of what we're seeing with these vaccines. All right, let's see what else he has to say.
Decades ago, children received only a small fraction of the vaccines required today. In those times, people were much healthier, and of course, the high rates of autism now observed did not exist.
And there we have it. There's the vaccines and autism claim. I was very hopeful when I saw that this was not in the written executive order itself, that maybe we were going to skirt around this as an issue. But right here, right from the press briefing, and this is unfortunately a topic that comes up again and again and again and again in this press briefing from different people, this notion of vaccines have to be causing autism because vaccines have increased and autism rates have increased. And if it's not vaccines, it's some other environmental trigger, but vaccines are the most probable one. And it's hard to hear this argument again and again because this has been studied so many times by so many groups, and there has never been any significant evidence linking vaccines to autism. It simply doesn't happen. And the fact that this continues to come up from the United States senior leadership is just evidence as to how much we're not looking at science, we're not looking at statistics, we're not looking at data, we're looking at emotions to drive policy and drive health decision making.
Large amounts of vaccine, large amounts of like vats of vaccine are currently pumped into your child's body. And we're doing 20% of that at each visit. And we'll let time elapse between visits so the body can handle this massive amount of fluid being pumped in.
And we see that language again, large vats of vaccines injected into your child. And again, the language, the choice of language is important here because these are not large vats of vaccines. These are small doses. There's also a big challenge, and so a recurring theme through this press release, through the executive order itself, is this idea of we want the same number of vaccines, but we want them in smaller doses across more visits. And this is something that Trump said way back in his first presidency. You know, smaller vaccines, smaller doses, more visits, same number of vaccines. There's two challenges here. One is, of course, the scientific challenge of these diseases, the ones that are vaccinated against in early childhood, primarily that 5-in-1 dose, those 5 diseases have significant health risk, negative health risks to children. They have significant morbidity and mortality associated with them. And it takes multiple doses to bring a child's immune system up to the point of immunity. So this is where that claim of at 1 year we want 5 visits over that 1 year to get the same thing you'd get in 1 visit, but we don't do only 1 dose of the 5-in-1 vaccine in the first year or 15 months of life. We do multiple doses. So you're talking 10 to 15 visits now in that first year. And so not only is this going to prolong the ability and the time it takes to develop immunity and cause a direct risk to health, but there's also an operations side of this. And so let's picture, for example, lower economic or families living in poverty, low-income families, families without access to a primary care physician, especially in areas like much of the United States, where you don't have the luxury of a prolonged 1 year or 18-month paid maternity leave. And so families are immediately having to go back to work early in order to continue to provide for their children. In those areas, now you're going to have difficulty getting appointments. You're going to have difficulty getting time off work. You're going to have difficulty finding the time in your own day, dealing with a newborn, trying to get to all these appointments. This is going to have a huge health equity impact beyond just the mainstay concepts of impacts to the vaccine efficacy. Huge potential fallout for this beyond just the actual scientific and medical fallout.
Millions and millions of parents feel they've been pressured when their children are just weeks out of the hospital to take 5 shots, 6 shots, 7 shots all at once. They're told it'll be normal. Your kid will have a fever of 103 for 3 or 4 days. Your kid will stop eating for a week. Your kid's going to change all their sleep. Don't worry, it's totally fine. It's totally normal. Nobody has studied it. Nobody's looked at it. Nobody's thought about it.
So that's Steve Miller. And I mean, if Trump was completely unfounded with some of his statements, these statements are absolutely bonkers. So I mean, first off, the idea of a few weeks out of hospital, you're getting 5 shots, 6 shots, 7 shots. Again, that's not what's happening. These aren't vats or soda bottles of vaccines, large volumes of fluid being injected here. So in Ontario, when my son was 2 months old, he had his first vaccines as part of the regular Ontario vaccine schedule. So at 2 months, he got 2 injections and 1 oral vaccine. So the 5-in-1 vaccine, pneumococcal vaccine, and then rotavirus, which is an oral vaccine. So we're talking 2 infusions. That's it, not VATs and 5, 6, 7 vaccines. But we also have to look at this claim, this statement of no one's looked at it, no one's studied it. What crazed statement is that? Vaccines have had significant analysis, both during the initial development, safety checks, rollouts, and ongoing studies and analysis and looking at impacts of vaccines on varied health outcomes ever since. There is massive amounts of data here. And for him to come on stage and repeat this as rhetoric or spout this as rhetoric is fear-mongering. Nothing else than fear-mongering. And so throughout this press release, there's a lot of statements about how some European nations don't require vaccines to attend school, for example. They rely upon trust in healthcare leadership in order to convince people that vaccines are useful and important. But then you turn around and you have people spouting off this to basically come up on stage and say, every scientist and physician has been lying to you for decades, and expect that that's going to win graces with people in terms of trust in the system. There's no foundation, there's no science, there's no rationale behind these claims. They are completely non-factual, they're complete fear-mongering, and this does nothing but erode public health in the United States, which unfortunately, because of the influence that the United States has, erodes public health measures in other developed nations around the world.
This order does 2 fundamental, incredibly important things. First is we get off of this ridiculous path of having our children get 70 to 90 shots. That is wantonly excessive. Remember, each and every one of these shots produces a profound immunological response. So across any large population, if you give a kid shot after shot after shot, you're going to have vaccine injuries. You're going to have immunological issues. You're going to have potentially neurological issues.
And there we have it again, just more claims with no scientific foundation. There has been no scientific studies that are showing that increasing the number of vaccines you receive leads to this wanton neurological and immunological damage in the population. I'm also curious about this 70 to 90 shot metric that they're referencing. And I'm struggling to figure out how they got to that number. I calculated, just counting the pre-January 2026 schedule, and got to like 45 shots. Maybe it's more if you include influenza and COVID vaccines in there. But if you're sticking to like just the mainstay childhood vaccine schedule, it's somewhere around 45 doses of a vaccine, and that counts the 5-in-1 as 5 separate doses. Reality, it's far less than 45 actual injections. Ontario, much the same way. Canada, much the same way. I counted, and Ontario, my son, by the age of 18, will have received vaccinations against somewhere around 45 individual targets, including reboosting and counting that 5-in-1 as 5 separate targets. That's not a reliable metric on how many actual injections a child is receiving. But it's also important to recognize that when we are walking around our daily lives, when an infant or a toddler is going around their daily lives, especially young children who, of course, love to put absolutely everything into their mouth, they are constantly being bombarded and exposed to antigens. They're constantly being exposed to more and more and more pathogens. We do not live in a sterile world. And that is incredibly important. It's an incredibly important way to develop their microbiome. It's an incredibly important way to develop their immune system. And, truthfully, if we look at things like in COVID, we look at some of the negative outcomes or fallout of lockdowns. We saw that a negative impact of, or not just lockdowns, but of all public health measures, where a lot of other pathogens got suppressed dramatically. And then as those restrictions get lifted, those pathogens have a significant resurgence through the population. And that is an off-target impact, like we talked about a few weeks ago in a video, of COVID-19 public health measures. Not going to get into the debate on whether those were appropriate measures or not, but what stands to reason here is that we as humans are constantly being bombarded with pathogens. That's hugely important for continuing to grow and develop our immune system. So to sit there and say a child or an infant doesn't have the immunological capabilities to handle this exposure because there's too much antigen, there's too much vaccine all at once, is absolutely ludicrous. Children, infants, babies, toddlers, adults, everyone gets constantly exposed to large numbers of antigens every single day. That's how our immune system grows and develops. We are built to handle this exact scenario of trying to receive multiple pathogens all at once and develop concurrent immunity. So this press conference just continues with much of this same discussion, same rhetoric, same talking points. Autism's a big question mark. We want same number of vaccines, but we want them smaller doses, more widespread. We're making these changes to bring us in line with European and other developed nations. None of these are factual or scientific points. And all the while, we are seeing a huge resurgence of measles through North America, through Europe, through the United States, through Canada, a disease that has had significant impact on childhood health and safety is making its comeback because we have too much vaccine skepticism and things like this, these talking points with people in high points of influence, spouting nonsense and spouting that vaccines are unsafe is just going to continue to fuel this rhetoric. And now, the argument, of course, is that who cares if kids get measles? We used to get measles all the time back in the day, and it wasn't a huge issue. But kids do die from measles. People do die from measles. And death isn't the only negative outcome. Kids can have very severe side effects from a measles infection, encephalitis, pneumonia, requiring hospitalization, requiring or with significant decrease in health, significant morbidity. Measles is not a benign infection. It has significant risk. It has risk to those who are still vaccinated but are immunocompromised. It has risks to pregnant mothers where measles can cause significant birth defects if it occurs very early in pregnancy. Measles is not a benign virus. But there's another really intriguing aspect of measles. So when scientists looked at the impact of the original measles vaccination program, what they found was when you roll out a measles vaccine, it drops the all-cause mortality in children far more than you would expect from just eradicating measles itself. So let's take a second there, unpack that statement. So eradicating measles reduces the mortality from other infectious diseases. And there's a reason for this. Measles likes to infect immunological cells. It infects T cells and B cells. These are the cells that are largely responsible for the idea of immune memory. They're largely responsible for what allows our immune response to develop antibodies, to develop memory, and to reattack something and make sure that when you get reinfected or re-exposed to something you've already seen, you get a less severe outcome. By eradicating these cells, we see a concept in measles called immune amnesia. So measles infection can reduce our memory of previous infections and previous pathogens, making kids, making infants, making toddlers now more at risk of redeveloping the same thing they've already had and getting it as if it's their first time being infected with it. This has significant impacts on health outcomes. Measles is not a benign infection. It is absolutely something that needs to be taken seriously and needs to be vaccinated against. It's also one of the most, if not the single most contagious pathogens on the face of the earth. It is a true airborne virus. It has an airborne infection rate that is so low, or infectious dose that is so low that one virion floating down a hallway may be sufficient to cause infection if you are susceptible. This is a pathogen of significant risk. And the fact that we're seeing now a complete erosion of decades of work at largely eradicating measles in North America and in other developed nations is absolutely terrifying. With that, we're going to leave this here. Tons and tons and tons is already hitting YouTube, hitting social media, hitting other platforms, unpacking different aspects of this this debate, of this press release, of this executive order. And of course, we've seen with other executive orders in the past, a lot of legal challenges in the states, a lot of federal courts suing and taking up the fight against these as largely inappropriate measures. So time will tell what we see that actually comes out of this. The important thing here is to continue fighting for appropriate scientific understanding and foundations behind policymaking and behind public health measures in all countries across the world. With that, we're going to call it here today. Thanks so much for joining. Leave a like and a comment below if you liked this video. If you have any thoughts, any questions, anything you want to hear more about on future videos, throw me a comment down below. If you like what you saw, please subscribe to the channel, and we'll see you next time on Microbially Speaking. Thanks, bye now.